Hello, my name is Lisa Davis, and I'm doing the RN program here, which is a registered nursing program at Valley College. I have a few hobbies. I like to watch TV and look at some TikTok video and maybe do a little Scrabble if I get a little time to do that. But prior to COVID, I had a much more activity onto. I used to go to the regular gym. I used to go to church. I used to go to group meetings and everything. But with COVID, I'm relegated to being just here at home. But 5 years ago, when I lived in Toronto, Canada, I used to do lawn tennis. I used to do basketball. I used to do hiking, everything. Now look what a sedative lifestyle has done. I blew up like a balloon. I must have put on 50 pounds. But I'm not one to be embarrassed about, really think too much about my embarrassment and misfortune. But I do remember many years ago when I was a younger person, I went to the hospital because I was having an allergic reaction. And I explained this to the doctor. But he had looked into my file and decided that I am having an appendicitis rupture. And so I tried to get him to give me the EpiPen like the other hospital had done. I had gone to another hospital before. In fact, I'd gone there twice because it came first in my chest and then it came back again in my throat. I could hardly breathe. I was struggling to breathe, but because I was still having my armband and I was already there, it was quick when they were able to provide me with that Merca potion, the EpiPen, and I was all right again. So I'm here at this new hospital where my sister decided to take me, and I am asking for this EpiPen once more. But this doctor decided that I'm having a ruptured appendix because my abdomen is hurting. I tell him, no, it is the allergy coming back. And he was quite mad. He said, are you the doctor or am I? Of course, I'm nervous and frightened, and so I shut up. I said nothing. He stormed off with disgust. A really compassionate nurse came over to me, and she was explaining what I need to do to get ready for the operation. So I was getting ready, but I became so much pain I was having. My pain scale was like 10 out of 10. And so I could not continue just knowing exactly what is wrong with me and feeling all that pain and let him do an operation to remove my appendix when that's not the issue. But I begged the nurse. I decided to beg her, and I held onto her hand and begged her to help me. Please help me, I said. I'm in too much pain. One thing does not negate the other. If you give me the EpiPen now, you can still do the operation to remove my appendix. And she said, you know what? I'm going to give it to you. But anything happen, it's on you. I said, yes, please, I said. And she gave me that miracle potion. And within 5 minutes, I was up and putting on my clothes and getting out of there. Here's the doctor coming, running after me. Oh, what happened here? I wish I had done public speaking then, because I would be better able to advocate for myself. And as a nurse, I'm going to always need to advocate for my patient. Nursing is very much intertwined with public speaking. You're always going to have to speak to the physicians and ask for medication, and especially in the field that I'm planning to go into the ICU, you must be able to quickly ascertain the medication and the procedures that needs to be done to get that patient back to normal, normalizing the patient, because the doctors most times are not there immediately when something is going wrong. Falling blood pressure, dropping blood pressure may be 60 over 40, or elevated heart rate 200, 170. Those things can send the patient into shock, so you must be able to advocate for your patient to be able to do this. And this is the field that I'm planning to go. My life's goal is in the ICU, and I need this public speaking is very important for that. If you are getting audited, you must be able to eloquently explain to the auditors what is happening, with the patient, what you're doing to help them, everything. So that is most important. One interesting thing you must know about me is that I'm allergic to garlic. I'm allergic to everything that have every trace of sulfur in it. Sulfur, sulfite, sulfate, everything. And that pungent smell that garlic has, that's what is sulfur in it that you're smelling. Scallion and onion does have it too, but on a lesser scale. It's not as bad. And yet, I work in the COVID unit of the ICU currently with all the patients, not just 1 and 2 like the nurses, all the patients. So I have to be very careful because the doctors give you sulfur preemptively if you get the COVID. That's the first thing they give to you. Thank you for your attention. Bye.